headed next is to the reconciliation approach. Gallup also asked that question. Explain to the American people what it meant so they understood what this word that we use around Washington actually means. And in the Gallup poll, American people were opposed using that 52 to 39. So this has been a fabulous discussion, Mr. President. We have a lot of experts around the room. But I think it's really important, since we represent the American people, that we not ignore their view on this. They have paid attention to this issue like no other issue since I have been in the United States Senate. Health care is a uniquely personal issue. Obviously, you get more interested in the subject the older you get, but every American cares deeply about the quality of their health care and access to health care and cost of health care. They have followed this debate like no other, and they have rendered a judgment about what we have attempted to do so far. The solution to that is to put that on the shelf and to start over with a blank piece of paper and go step by step to see what we can agree on to improve the American healthcare system, which is already, as all of us agree, the finest in the world.
I'm just going to make this remark, and then I'm going to call on Patty Murray. I'm going to save the two lions of the House here for the end. Because there's been a lot of comments from every Republican about the polls and what they're hearing from their constituents. And as I said, I hear from constituents in every one of your districts, in every one of your states. And what's interesting is actually when you poll people about the individual elements in each of these bills, they're all for them. So you ask them, do you want to prohibit pre-existing conditions? Yes, I'm for that. Do you want to make sure that everybody can get basic coverage that's affordable? Yes, I'm for that. Do you want to make sure that insurance companies can't take advantage of you, and that you've got the ability, as Ron said, to fire an insurance company that's not doing a good job and hire one that is, but also that you've got some basic consumer protections? Yes, we like that. Polls, I think, are important in taking a temperature of the public. If you polled people and asked them, is the system working right now, and should we move forward with health reform, they'd also say yes to that. And my hope had been, and continues to be, that based on this conversation, there might be enough areas of overlap that we could realistically think about moving forward without a situation in which everybody just goes to their respective corners and this ends up being a political fight, because this is something that really has to be solved. We've got three people who have not had an opportunity to speak today. If you don't mind, I would like to, in the interest of time, just go ahead and let each of them speak. If there's an intervention that somebody on the Republican side wants to make, then I will recognize them. And then I will allow anybody of your choice, Mitch, to wrap things up. I think Speaker Pelosi may want to say just a quick summary of what she's thinking, and then I will talk a little bit about next steps. And if everybody could keep their remarks relatively brief, that'd be very helpful. Patty.
Mr. President, thank you. And this has been, I think, a very good discussion. And I think all of us come to this table today having heard a lot of stories and talked to a lot of people and bring their passions with us today. And I certainly am one of those. And every time we talk about this, every time I think about this, I remember a little boy that I met last spring who was 11 years old, whose name was Marcellus, and he told me that his mom, single mom, taking care of him and his two younger sisters, was going to work every day, had a job managing a fast food restaurant, was doing okay, but she got sick. And when she got sick, she had to take time off from work, and because she was missing so much work, she lost her job. When she lost her job, she lost her health care. And because she lost her health care, she couldn't get in to see a doctor. And sadly, Marcella's mom died. I think about him every time we talk about this bill. And what happened to her is happening to so many Americans who, when they get sick today, don't have any choices. They have nowhere to go. Either they don't have insurance, or they've been denied insurance because they have a pre-existing condition, or they're a small business whose premiums have gone up so dramatically that they can no longer afford to provide it for their employees. Too many Americans today are in a box and they don't have a choice. Frankly, it's why so many Americans today are passionate about a public option. It was a choice for them that they felt was important to them. But in the bill that you have presented and that we've been working on that is so important is it finally gets some people out of that box of no choices. By giving them an exchange that they can go to, by taking care of the insurance reforms so they're not denied coverage, by opening up community health centers so people have choices, by making sure that we lower the cost for all Americans, because when we provide coverage for 30 million Americans, it lowers the cost of everyone who has insurance today by $1,000 a year a family. This is why this is so important, and what I have listened for today is whether the alternative proposal that has come before us gives people those choices that they need. And that's what I'm listening for, and I go back to Marcellus and I think, will that proposal make sure that nobody loses their mom again because they didn't have a choice? And that's why it's so important that we move forward with what we have and open that door for so many Americans.
Thank you.
Mr. President, Dr. Coburn.
Tom.
Great. I just was going to summarize shortly because we were talking about if we don't think about what the key goal is, the key goal is to reconnect purchase and payment so we become good purchasers. Whether we create what system we do, if we don't reconnect the mechanism of payment with purchase, we're not going to get good value out of our healthcare system. And I outlined $1 out of every $3 that doesn't help anybody